Okay. Okay, how are you? Now I'm going to translate that last video about 3 questions 3 moms asked me, and I'm going to read these questions. The first one is from Lorena Vargas. It say, "Hello, I have." Yeah. Okay. Say, okay. One moment, please. Okay. It's a one moment. Hello. I have been told that if you have a C-section or cesarean section, you can start taking colostrum from week 37. My question is, after extracting the colostrum, I have to keep pumping milk so that the production does not stop until the child is born. Okay, my answer is she's asking me if she can uh, do an extraction because she want to start to do extraction because she's pregnant, but she have one programmed C-section for um, next, I think in 2 weeks more, because she right now have 37 week of pregnancy, and she wants to start pumping because when in some countries when the mom have C-section, usually they are separate the mom from the baby from the mom, and sometimes the baby is not close to the mom, and in some hospital they give bottle formula in the bottle, so she's worried about that, and she wants to be prepared for that day, starting to get her own breast milk or colostrum milk. That is the first milk they produced before the date, and she wants to start to extraction before the due date. So that is the question. And my answer is yes, you can. Most women start producing milk in week 30, so you can do not have to worry about losing colostrum because your body will produce it for a certain time after a birth. After the birth of your baby, the colostrum continues to be producing until a month of age. And some women even breastfeed their first child during the new pregnancy in the tandem lactation. So it's very possible. However, this need to be aware about this because some women, um, well, you should not have an history of having gone through the preterm labor because the oxytocin hormones contribute to contraction. So if the mom has been living a preterm labor, they can avoid this because the baby can the due date can be before to the time. So while the doctor told you that you could have sex, That means you can also breastfeed or pump your milk during the last week of pregnancy because an orgasm releases much more oxytocin than breastfeeding. So that is very possible to do that. That is the answer. The other question is from Marcela Aguilera Ortiz. And this question say, good evening. I have a consult. I am taking milk with an electric extractor. I am 20 minutes trying to get out and only get 30 milliliters, that is about an ounce, between the two breasts. So she only gets around 1 ounce between two breasts. So it's very few quantity. And she said, I can live more. She can get more. So I have doubt that is I take that quantity. What is will take my baby sucking on his arms? My baby sometimes suck 5 minutes and sometimes 20 minutes. So she's worried about that because when she's pumping her her breast, she only take very few minutes and she thinks the baby is taking very few breast milk also when is breastfeeding her baby. And the answer for her, for Marcela, is that the mistake of the majority or most of the mothers who use the pumps extractor to save milk is um, they use this because they need to use this breast pump because sometimes they need to do a milk bank before returning to work or school. Um, this milk help them to use when they are not present, and other babysitter can give her his own the same breast of the mom, the same milk of the mom. So they do that for half milk, freeze it or have a reserve of breast milk. Okay, so the answer is to produce more milk. It is recommended to practice the powerful extraction technique, that is hyperstimulation method, for 72 hours continuously. It works like this: extraction 10 minutes, 10 minutes in both breast with an electric breast pump, and rest for 45 minutes or 1 hour. And then you have to do that this extraction every hour and another 10 minutes, and rest an hour and continue doing that for all day. And only you have you could rest 4 to 6 hours to sleep in the time you are sleeping at night, or and do this for 3 days for 72 hours continuously. And this method helps you to produce a lot of milk because the stimulation. This method is very tired, but it works. And this is the method established by Catherine Watson, is a lactation consultant from the United States. And the other question or the other concern she has is that she thinks the baby is not feeding well because she thinks it's very few milk she's producing. However, the answer is you don't have to worry about how long time your baby lasts in your chest, in your breast, because she will surely get exactly the quantity she needs because the extraction of the baby is very different to the extraction of the breast pump, and you don't have to be worried about that. Okay, the last question is from Montserrat, and it says, "Hello, good evening. I am a new mom. I was waiting today to ask a breastfeeding question. I would like to know how to get weaning little by little and continue giving breast milk in a bottle. Uh, of course, a breastfeeding, doing breastfeeding at night. My girl is 9 months old, and I want her to hold the bottle. She wants to start to weaning because I don't know why, but she wants to start weaning her baby, and she's asking how do the weaning or how to start doing that because um, her baby is 9 months right now. Okay, the answer is I do not recommend that at this age, at 9 months, she start to introduce the bottle because usually the bottle when the baby use the bottle is because they use since they are very young with 3 months or 2 months of age, but she's 9 months, and it's gonna be very hard for her to take out the bottle. Eventually, the health workers will tell her that at 12 months of age, um, you should start to take away the used bottle. No later than 14 months, no longer use it because the bottle use contribute to decay and have problem in the teeth for the babies. So they recommend stop the use of the bottle at 12 months or at least at 14 months of age. So she she is going to use very few times the bottle, and for take out the bottle to the babies is very difficult. So she's going to be problems for take the bottle. So I recommend that you start to give in a glass or a sippy cup. Even it is a little sippy cup, spicing the times she's breastfeeding, the time between one breastfeeding, and she will try to be longer and decrease the time she's breastfeeding. So try to give her also um, healthy food because she can eat now, and also give her water, a lot of water eventually because sometimes the babies, the babies, the old babies have when they have thirst, they usually look the mom to breastfeeding because they want to, they are thirsty. And that is the reason the old babies want to be breastfed. And also they want to be close to the mom because they want to sleep or they want only miss the mom, and that is the reason they want to be breastfed all the time. And they need to start to give in sippy cup, and it's there's more time between one breastfeed to another, and decrease the time when it's breastfeeding. That is the recommendation for her. But all this, the most recommended is that she continues giving breast milk because it is the best thing. The vesting still benefit continues to both for the baby and for her in the stage extended lactation. Also, I understand that is difficult sometimes for the mom continue breastfeeding when the baby are older, and sometimes they cannot do that. So we need to understand the moms that not all the mom can breastfeeding her babies, their babies. So I understand. So sometimes we want all the women breastfeed their babies, but sometimes it's not possible. But it's the best recommendation for all you. So thank you very much. And that is the translation of the last video I talked last time. I That's all. So bye bye everybody, and thank you very much.